Hey everyone, thanks so much for joining me on the Bio Breakthroughs podcast. I'm your host, Jared Taylor. Joining me today is Dr. Marisa Cruz, the Chief Medical Officer at Empatica. How are you today?
I'm doing very well. Thanks so much for having me.
I'm excited to have you. Let's dive right in. Tell the audience about your background.
Absolutely. So as Jared said, I'm the Chief Medical Officer of Empatica. I'm a board-certified internist and endocrinologist, and I spent about 7 years in total at FDA in various capacities after I finished my clinical training. The last few years of my tenure, I spent at CDRH, the Medical Device Center, focused on digital health policy development and helping startups and other industry members to navigate some of the FDA guidelines around what is a medical device, what does it mean to be regulated, et cetera. I then moved to the private sector and have had a few leadership roles in medical device companies that are really focused in the digital health sector, including prescription digital therapeutics and digital biomarkers. So I'm thrilled to be with Empatica now. I help oversee the regulatory and quality group, as well as our data science group that helps to develop our proprietary digital biomarkers.
What was that transition like going from going into the private space?
Yeah, it's a great question. I mean, it's I feel very privileged to have been able to see digital health from so many different angles, right? And I think you see it in clinical practice as an endocrinologist. Diabetes is actually a space where there's been a lot of innovation in medical devices over the past several years, including patient-facing digital health interfaces. So you get to see it from that clinical practice standpoint. Obviously, as a regulator, thinking about what are the boundaries of law and regulation? What is a construct for safe and effective development of algorithms that can be put into clinical practice or used in research? And then on the private sector, I think there's the perspective of needing an agile but consistent framework within which to innovate.
For those that let's assume there's still some people that haven't heard of Empatica. Give us an overview of the company or where things are at today, and also talk us through your health monitoring platform.
Absolutely. So Empatica was founded in 2011, actually as a spinoff out of MIT. So it came out of a lab that was founded by Dr. Rosalind Picard, and her team was really focused on effective computing and development of wearable technology that could seamlessly, unobtrusively, and continuously monitor patient data for more actionable insights into health. Empatica has grown a lot over the last couple of years. We're now a team of about 120 people, quite a diversified group, with a real shared commitment to meaningfully changing healthcare through innovative technology. And we really care about patient outcomes and improving the research base by which people develop innovations in healthcare delivery. So our software and our algorithms have really been created to help professionals in both research and the clinical care setting to achieve that goal through a better understanding of human physiology. And we do that through, as you mentioned, the Empatica Health Monitoring Platform. We've built a full stack platform that is FDA cleared and enables continuous data collection in order to support insights into human health across a range of physiologic and behavioral digital biomarkers. So those span clinical domains from CNS biomarkers through physical activity, sleep, cardiac activity, and respiratory data. Just for a little bit more detail, the platform is really powered by the Embrace Plus smartwatch. So that's equipped with a number of advanced sensors for robust data collection. That's a wrist-worn device. And then that can be combined with our proprietary care software suite. So that goes from an app that is used by either the research participant or the patient, and then is coupled with our secure cloud infrastructure and, as I mentioned, our clinically validated digital biomarkers. So that united sort of comprehensive platform enables clinicians and researchers to pursue remote monitoring as well as data collection for research purposes.
Specifically for researchers, what are some of the values and benefits of embracing these digital biomarkers?
So I think the real potential, what gets me excited about the space is the possibility for additional granularity beyond what you get for periodic clinic-based standard measurements, right? That typically in a research study, you might have a research participant who comes in, monthly for a set of assessments. And while those are valuable and clinically validated, they're only a snapshot, right? And they can be influenced by things such as the site staff or the protocol. They're less reflective of kind of real world settings. And so I'm excited by the idea of continuous data collection, as well as more of a glimpse into what physiology looks like in a real world setting, because I think it can provide valuable insights into health that might have otherwise been overlooked, right? It enables the ability to triage, to identify early signs of potential clinical deterioration, or even to give us more insight into a disease state earlier in the process.
I would love if you could also dive into specifically advanced methods of remote patient monitoring, specifically how it or sorry, not how it, what it offers in terms of decentralized clinical trials and beyond that. It's been a topic that we've had. We've had companies come on talk more about decentralized clinical trials, but this is kind of a different spin in terms of the remote patient monitoring piece. Would love to hear your thoughts.
Yeah, absolutely. I think this type of platform is really ideally suited for either fully decentralized clinical trials or for hybrid trials, right? Where you combine some degree of remote patient monitoring in a home setting with traditional clinic visits, right? To get different kinds of assessments. And obviously, the data collection is administered by slightly different personnel in each setting. Um, our platform has been used quite widely in a number of those types of trial settings. And I think the benefits of using this kind of platform for research really centers on measures of increased retention, increased adherence, and as I mentioned, reduced reliance on point in time measurements. So to the first 2 points, increased retention and adherence, I think, is really getting at patient access to research, right? It's known that less than 5% of people who are eligible to participate in clinical research actually do. And a lot of those barriers to participation involve time to get to the clinic, the ability to be aware of that the research is happening in the first place, and then at times the geographic distance from hospitals who are participating in research that's relevant to you can be insurmountable. And so I think increased retention really gets to one, breaking down some of those barriers to access for clinical research, and then two, making it very intuitive and easy for patients to participate, right? It's a comfortable, intuitive interface that patients can wear to go about their daily business, and continuously and passively collects data relevant to the research. Um, I think that patient experience is borne out by evidence of increased adherence, and we have had a couple of studies where we've looked at the drop off in patients using the smartwatch over time, and have found really impressive adherence numbers with up to 90 to 95% of patients using the watch continuously throughout the multiple week study period. And then, as I said, reduced reliance on point in time measurements, I think, is incredibly helpful to raise the bar of objectivity related to clinical research data collection. Um, when we rely on either self reported data or these snapshot measurements, I think. Again, while very valuable in certain settings, I think they do have a degree of subjectivity, and they do have a degree of sort of challenges in inter-rater reliability, the ability for one person to be capturing the same sentiment as another person from a slightly different vantage point. So the ability to collect data that's objective and consistent and high quality, I think, is a real advantage in the clinical research space.
Staying on this topic of clinical trials, and really focusing on something that everyone cares about, right? How is Empatica ensuring both safety and data protection when utilized in these clinical trials?
Yeah, that's obviously an incredibly important point, and one that's brought up early in conversations when we think about new collaborations and partnerships. So, data protection and data security, patient privacy are very foundational to Empatica, and the Empatica Health Monitoring Platform is fully compliant with both HIPAA and GDPR, and that really means that all collected biomarker data is de-identified. It's not linked to the personal information of users, and it enables users to be able to request that their personal information it can be deleted at any time. We also make sure to protect the patient's data collection during studies using security measures, including um, creating de-identified databases, encrypting the data, which is crucial, and then using those controls in conjunction with elements that were designed to preserve and prioritize confidentiality, data integrity, and data availability.
And one of the things I always like to focus on whenever we have a guest on the show is in terms of what's next. So, what's next for Empatica that's getting you really excited that you can share with us here today?
Absolutely. So one thing that I've been very excited about recently is the launch of our Actigraphy mode. And one thing that I think Empatica really stands out from other offerings in the marketplace with is our customizable sensor modes. So that really allows for researchers to focus on specific parameters that are of most relevance to their clinical trial while maximizing battery life. And the Actigraphy mode launch is our fully maximized battery life of up to 14 days, which is, I think, a real significant improvement on other offerings on the market. And again, get to those underlying goals of making this a very seamless experience from the perspective of a patient. So only needing to charge every week or two instead of a daily or every few hours kind of charge is a significant improvement on the patient experience. Um, we've also enabled an option for researchers to develop their own digital biomarkers using our platform, which allows for further customization of sensor performance to specific study needs. And so I think this has always been sort of in the roadmap for Empatica to have a very usable sort of off the shelf offering that is again full stack and fully integrated, but to allow for this degree of customization. And I think the Actigraphy mode is a perfect example of where we've optimized both sensor parameters and battery life to enable I think an improved patient experience and an improved researcher experience.
I want to thank you, by the way, so much for coming on the show and sharing your thoughts and telling us more about Empatica. And I hope we can have you come on in the near future. We can dive into some more topics and go from there. But really, really excited and super happy that we were able to chat today and wishing you all the best.
Absolutely. Thanks so much, Jared. I really appreciate it.